video 16, we will continue with the next topic, which is a neurogenic bladder dysfunction. So this neurogenic bladder dysfunction happens whenever there is a damage to the central or peripheral nervous system. It leads to dysfunctioning of the bladder. Then that condition is called as neurogenic bladder dysfunction. Okay, so the term neurogenic bladder refers to several bladder dysfunctions caused by lesions of the central or peripheral nervous system. Types, it is depend upon which nerve gets infected and the extent of the nerve damage. So based on that, there are 5 types, which is uninhibited, sensory paralytic, motor paralytic, autonomous and reflex. Next, talking about the etiology and risk factors, mainly it is any tumors or neurological disorders, trauma to CNS. Tumors which will be suppressing the central nervous system or any nerve can lead to dysfunctioning of the bladder, causing neurogenic bladder. So when we say neurological disorders, it can be like Alzheimer's disease, multiple sclerosis, Parkinson's disease, injury to the spinal cord and stroke. Now talking about clinical manifestation. So when we see clinical manifestation, mainly we will see that the patient will be having bladder dysfunction with retention of urine or incontinence. Okay, so the person will have retention of urine, or he or she will suffer with incontinence. Next, we will go to management. So when we talk about management, bladder training has to be given. Already in the previous conditions we have studied types of bladder training that has to be given, Kegel's exercise. Okay, so please go through that. And then antispasmodics, anticholinergics drugs has to be given. Example given here is oxybutynin. And then prevent complications like autonomic dysreflexia. Now what is this autonomic dysreflexia and how do we prevent? Even as a nursing management, we should be able to prevent this autonomic dysreflexia. So when we say this autonomic dysreflexia, it is a syndrome in which there is a sudden onset of increased BP, or suddenly the patient will develop hypertension. So how do we prevent this? So to prevent this, we should always inform to the patient to empty the bladder. Do not let bladder become full. It should not be a retention of the urine in the bladder. So the patient should void in order to empty the bladder. Pain should be controlled. If the patient is having any kind of pain, it has to be controlled. Then practice proper bowel care to avoid stool impaction. Okay, so constipation of the stool should not happen. So make sure that they follow proper bowel movement, otherwise it will also lead to the pressure. Okay, and then practice skin care to avoid bed sores. If in case the person is having fecal matter, if he is passing, or urinary incontinence or fecal incontinence, we have to make sure that we provide them proper skin care. Otherwise the patient will develop, because of the soiling, it can lead to bed sores. Then prevent bladder infection. So these are the various ways how we can prevent autonomic dysreflexia. Next, administer medications like diazoxide and phenylbenzamide. Okay, so next is nursing care. So when we talk about nursing care, we have to prevent, we have seen, right? So you have to assess the patient's condition, then any pain, intensity of pain, and then renal intake and output chart. Then we also have to take measures to prevent autonomic dysreflexia. So in this case, we will have to educate the patient regarding all these, how we have to prevent it. And then we have to administer medications like dioxide and phenylbenzamide. Okay, so nursing care. So talking about the nursing care, we have to prevent it. Okay, and then we have to perform. Okay, and then we have to perform intermittent catheterization should be done to the patient when the patient is not able to urinate. Okay, so sorry, I got confused with 4th point of this medical management. So nursing, it is as I've told you, till autonomic dysreflexia prevention. Then we have to teach methods to stimulate maturation, how to void, hold it, and then we have to make sure that according to the bladder training that we have seen already. So not holding for a longer time, for every 2 hours they have to go and do, and Kegel's exercise, which will actually strengthen the pelvic muscle. And then we have to perform intermittent catheterization only if the patient is not able to void, then teach intermittent self-catheterization. Every now and then they cannot come to the hospital, so it has to be taught to them. Okay, so this is all about neurogenic bladder dysfunction. We have seen here about the definition, the types, etiology, clinical manifestation, management, nursing care. Next we will go to renal cyst. Now what is this renal cyst? It is a kidney disease caused by solitary or single or multiple cysts that is filled with fluid. These are sacs which are filled with fluid situated at the surface or within the kidney tissue. Okay, then we call the condition to be renal cyst. So it is a fluid filled pouches in the kidney or sacs in the kidney that may or may not cause symptoms. So disease associated with multiple renal cyst is also known as cystic kidney disease or polycystic kidney disease. So either we call it as cystic kidney disease or poly when we have more, okay, more than one, okay, then we call that to be polycystic kidney disease. So what are the various causes? So renal cysts do not have a clear-cut cause, and then one assumption is renal cysts develop with the top layer of the kidney becomes weak. So when the top layer of the kidney becomes weak, what happens is there is a pouch formation then which gets filled with the liquid. So this is one of the main cause when the upper membrane of the kidney becomes weak. So it forms a sac or a pouch. Later this pouch is filled with the fluid. Risk factors, mainly it happens with the elderly age people, blunt trauma, any blunt injury that happens, and then symptoms. It is like non-infected renal kidney. So mostly when we see this is not infected, okay. So the other symptom, like the patient will have pain. Okay, so in case of non-infected, still we can see that the patient will have pain. So we know that flank dull to severe pain over the flank will be there. So may radiate to the lower back. So this pain can actually radiate to the lower back of the patient. Then abdomen pain is localized over upper abdomen. So we see that this pain also reaches to the upper abdomen, either left or right, depending on the side which kidney it is filled with cyst, that side the patient will be exhibiting pain. Okay, so infected, in case of infected renal pain. So in case of infected renal cyst, we will see what are the various symptoms that the patient will undergo. So the patient will have fever with chill, pain also will be there. So fever, so infected cyst may present with fever of unknown origin. Fever is often associated with chills. Fever often does not respond to anti-fever medications like Tylenol. So high fever will be there. So accordingly we have to report it to the physician and they have to be treated. Okay, so usually it doesn't respond to anti-fever medication. Tylenol it does not respond, so we can see like any other antipyretic as per the order should be given. Pain, when we say flank, there will be pain, is often moderate to severe in intensity. Examination of flank is associated with tenderness will be there. On touch the patient will have pain over the flank region and increased pain on examination and palpation. Then abdomen, when we say pain is localized over upper abdomen, either right or left side, whichever kidney is affected with renal cyst, pain is increased following examination. So pain is same for both infected and non-infected, but in infected there will be fever which will be high. So the antibiotic is the antipyretics which can bring down the fever can be given except of Tylenol. Then what is the diagnosis? History collection, physical examination, ultrasound can be taken, CT scan should be taken, MRI to find out these sacs whether they are multi or one. Okay, so that and how much is the size. So all this can be identified either in the ultrasound, CT and MRI. It will be still more easily visualized. So diagnosis of infective renal cyst, in that case we have to do the blood examination, CBC, complete blood count. So we will be able to know if there is infection. WBC cells will be increased, then ESR rate also will be increased, that is the erythrocyte sedimentation rate. Then again ultrasound, CT, MRI. Okay, so in both the condition of non-infected and infected, we have seen the diagnosis. Next, end stage renal disease. So in end stage renal disease, it is the last stage where the kidney is not functioning. In that case, when we say we have to do urine examination, we have to check proteinuria is present, low urine output will be there, hematuria, presence of the blood will be there, that has to be examined. Again blood examination, we will see that BUN will be increased, serum Serum creatinine also will be increased. Then when we say image studies, again USG, CT scan, MRI. Okay, so if the patient is having ESRD, okay, so this is end stage renal disease with renal cyst, then these are the tests that the patient suffering with end stage renal disease has to undergo. Next, talking about treatment for renal disease. So for non-infected, solitary or multiple asymptomatic renal cyst, no treatment is required. Periodic image study to observe the growth of the cyst. So we have to make sure that you know how big the cyst is becoming. So if it is not causing any harm, so no requirement of treatment is done. Okay, is required. Then we see solitary, single or multiple. In case of multiple is there, then pain medications should be given even the patient is having pain. That is non-steroidal anti-inflammatory drugs like Motrin, Tylenol or Celebrex can be given. It reduces the pain. Next, surgically, if you see, these procedures have to be done like when they are having pain. Okay, then percutaneous drainage of the tube, that is the drainage of the cyst, has to be done. So this is like IND, incision and drainage. This is done by draining the fluid filled in the cyst and then filling it with alcohol. So you drain it, fill it with alcohol to prevent it from recurring, so that there will be no relapse. But in most cases, the cyst formation recurs even after the procedure, and hence this sort of procedure is reserved only for certain situations. So they have tried, draining it and filling it with alcohol, thinking that there will be no filling by the fluid, but this has happened again. Okay, so they don't do it always. If at all, if it is required only, they do this percutaneous drainage of the tube. Next, you have percutaneous CT guided sclerotherapy of cyst. So here needle is inserted under CT guidance. Okay, then one needle is placed within the cyst, dye is injected to confirm the position of the needle, and then following the dye study, ethanol is injected into the cyst. Ethanol causes inflammation and scarring, which closes the cystic space. So now CT scan, like how you do, so like that, so somatography, okay, right? So here we use percutaneous CT guided sclerotherapy of cyst. What they will do here is needle will be inserted through the CT guidance. They will visualize, in the screen, and they will pass the needle there, and then this needle will be placed in the cyst. Dye will be injected to confirm the position of the needle. So through catheter it will enter, to the wherever in the upper membrane of the kidney, and then this needle will be exactly placed where the these sacs are there, and then they will actually, this will be found only through the injection of the dye, and later the x-rays will be taken simultaneously. It will be visualized in the screen. Okay, so now when the dye is injected into the cyst, automatically the ethanol, okay, so this is an alcohol, right? So this ethanol is also injected, so through the needle it will enter into the cyst. So what will happen? It will cause inflammation and scarring, and it will close the cyst. Okay, so this is percutaneous CT guided sclerotherapy. Sclerotherapy because we are causing scarring of the cyst there. Okay, so that's the meaning. Next is surgical explosion and removal of the cyst. So surgery for removal of renal cyst, enlarged renal cyst or a cyst that becomes symptomatic can be treated by surgical removal of the cyst. So what they will do is, they will do surgery. Okay, so all this enlarged cyst will be, removed surgically. So that is called a surgical explosion and removal of cyst. Next we will see in case of infected. So these are all, in case of non-infected. If it is not causing pain, no harm, nothing doing. If it is single or multiple but pain is there, then we give medication, then the patient has to undergo these procedures based on the severity of the pain. So infected solitary or multiple renal cyst, in this condition we have to give antibiotics, we have to give pain medication, surgical treatment, percutaneous drainage of the tube, surgical exploration and removal of the cyst, then endoscopic de-roofing of the cyst, complication of renal cyst has to be checked. So all these procedures only we will be performing even for infected solitary or multiple renal cyst. Solitary means single. Okay, so next we will go to renal cyst complication include. So what could be the various complications if this treatment is not done? Infection of the cyst can happen. In this case, the individual may experience pain and fever. Then rupture of the cyst can happen. In this case, there may be excruciating pain in the back of the sides or the sides. Then you have obstruction of urine flow. Okay, so in this case there may be formation of a medical condition called as hydronephrosis. So here what happens, there is fluid collection that happens, okay, within the kidney. Okay, so in this case there may be, so obstruction of the urine flow can happen. So these are all the complications if the renal cyst is not treated. Next and the last, in this we will see nursing management. So under nursing management, we have administer prescribed analgesics as needed by the patient. So now as usual, assess the patient condition, check the vital signs. If the pain is there, you have to find out the intensity, the location of pain. Okay, then assess through the pain scale, severity can be known. Then you have to give analgesics as per the order. Then nephrectomy. If nephrectomy, okay, removal of the part of a kidney is suggested or removal of kidney is suggested, then we have to prepare the patient for the surgery. Then provide symptomatic treatment, okay, so that will be given by the doctor. Chemotherapeutic drug should be given. Then what's the signs for patient for any pulmonary, neurological and liver dysfunction. Okay, monitor laboratory test for anemia, polycythemia and abnormal blood chemistry. Watch for adverse effects of radiation or chemotherapy that is given to the patient. Monitor the patient's degree of pain that I have told you. Then tell the patient what is to expect from surgery and other treatments. Then we have to explain to them, okay, about the surgery, what could be the expected complication. We should obtain consent and it will be explained by the surgeon. Okay, so we will be witnessing that. Then if surgeon has explained, if they have doubt, you can clarify. Otherwise, we do not involve in this. It is a sole duty of the surgeon to explain and the consent has to be obtained. Stress the importance of compliance with any prescribed outpatient treatment. Tell them, that they have to come for the, visits even after the surgery, after getting discharged. Encourage the patient to express his anxiety and fever. So please, we as a nurse, we have to make sure that we provide psychological support to the patient and relieve their stress and anxiety. So with this, we have finished with renal cyst. We have seen, what is it, okay, the definition of the renal cyst, and then we have seen what are the causes, risk factors, and then types, infected, non-infected, and what are the various diagnostic procedures that are carried for infected, non-infected, the treatment that is carried out, and then what are the complications that a person can end up, and then nursing management.